break. So, Dr. Khalid, Dr. Khalid, Palazzo. We can't hear you, Dr. Bamakharmah. Wa alaikum salam. You don't have the mic, actually. If you can put the mic up. Or maybe Dr. Palazzo can also
can you hear
help out.
Okay, so this is a case of non-Hodgkin lymphoma. Okay, so this is, after searching, we found this lymph node, which is in the para-aortic lymph nodes, para-esophageal lymph nodes. So the subcarina, there is no big lymph node that we can FNA. So the aim of this is to take FNB and to see the immunohistochemistry. So Dr. Palazzo, do you prefer 22 or 19 gauge needle? What does it change with you?
No, with FNB, new second generation FNB, 22 is okay.
So 22?
Acquire, here is Boston Acquire, okay, 22 gauge, it's sufficient. 19 FNB are more dangerous.
Okay.
What are the dimensions?
Here you are using the S. The S means that you can biopsy with the stylet.
What are the dimensions?
So we are inside the lesion now?
Yes, push more. Yeah, it's better. Yeah.
Take the stylet, slow.
So,
yes.
So I will do the modified slow pull. So look, I do 50 like this, then I move back.
Are you doing slow pull or negative pressure?
10 centimeter by 10 centimeter.
Yeah. Can you hear us?
What suction?
Yeah. So this is the
Lower
lymph
part.
node. So we are using 22 gauge needle FNB, and you can see Dr. Palazzo, he's pulling the stylet gradually.
And now we finished putting the syringe, and we use slow, low aspiration, 5 cc, to avoid to have too much blood. And you continue some movement.
So Khalid, Palazzo, how many insertion you go, and how do you know the adequacy of the biopsy?
We do not hear you well. Yes, I don't hear you well. The question, we don't hear the question well. Okay, so now it's finished.
Yes.
How many times you go inside? How many puncture?
20 times, something like this.
20? Okay, and how do you know the adequacy of the biopsy? It is adequate.
How do you know?
The adequacy of the
I
biopsy.
always become happy if someone cannot hear me.
Okay.
So I'm very happy.
We can see the core. We can see the core
on the
yes.
MOSE, macroscopic on-site evaluation. So we look.
How can you decide on the adequacy of the biopsy?
Yes, put the guide wire.
Can you hear us?
Yes, Janan. So Janan, usually what I see, I see it by my eyes. If there is nice core, that's. But now you can do MOSE. You can put it under the microscope and you can see the tissue, if it is enough or no. But usually in our unit we are using our eye, and if there is enough core tissue, that's more than enough.
And I think it's essential that you look for what I call them the white worms, not the red worms. Red worms are not diagnostic, they're just blood that's clotted.
I used to face this problem in the old days when we were doing liver biopsy without ultrasound guided. from the right lobe and left lobe. And at the end of the day, we puncture many times, and then the pathologist said, not adequate biopsy, please.
Still the same problem existing till now.
Nothing. We have to do
So you can see here the subcarina.
and not we don't.
There is
we
no
stop
enough.
doing
Oh, we can't hear you.
Once you push your scope,
So with Mohs, the results are very poor. So for the second pass, we do not do slow pull, we do strong suction.
suction, yes.
Okay.
Why? If you look at these nodes are very hypoechogenic and they are probably very fibrotic. And the slow pull does not work in this kind of node. We need suction.
And
So
slow
this is a
pull
very
or
nice. So this is a very nice point that if your slow pull did not give you any tissue, so in that case, better to use the suction, which will give you a better tissue.
So to conclude, we adjust our way to puncture to the first pass. We look at the results, macroscopic on-site evaluation. Then, when we see that we have a lot of things or a few things, few material.
and what are you going to send it for? Cytology, pathology?
No, it's for histology.
Would you send it for flow cytometry since you're suspecting lymphoma?
We send for histology, and they do everything they can do using.
Okay, I think our time is up. It's time for prayer. We thank all the moderators and the endoscopists. Really nice cases, a lot of discussion, and we hope to see you after the prayers, inshallah, and lunch.